Looking at the blood supply of the torso, we're starting at the heart with the aorta. The aorta has three branches leaving the aortic arch: the brachiocephalic trunk, which branches very quickly into the right common carotid artery and also into the right subclavian artery. It also branches off the left common carotid artery, and it branches into the left subclavian artery. The blood flows also then into the descending aorta, into the thoracic aorta. You can separate these names if you like, and then enters the abdominal aorta through the diaphragm. The first exit of the abdominal aorta is the celiac trunk. The celiac trunk has three branches: the common hepatic artery, which branches very quickly off into the right and left hepatic artery. It also branches off in the left gastric artery and into the splenic artery. You can see the spleen here. The artery turns back and runs across the pancreas. But let us follow now the aorta further to the inferior area. We find first superior mesenteric artery branching off towards the digestive organs. And from it we also have shortly afterwards, from the aorta, we see the left renal artery going towards the left kidney, and we see the right renal artery going towards the right kidney. Further inferior on the abdominal aorta, the next branching is the gonadal arteries, the right gonadal artery and the left gonadal artery going towards the gonads. And then inferior to these is the exit of the branching of the inferior mesenteric artery, supplying the lower part of our digestive system. The abdominal aorta ends, or splits, I should say, with the right common iliac and the left common iliac artery. The left common iliac artery and also the right split into the internal iliac artery and towards the pelvic region, and the external iliac artery, which then leaves the abdominal cavity and ends up into the, in this case, only the left femoral artery, as you can see. If we want to look at the veins, we would flow backwards towards the heart. So we're starting from the femoral vein, which receives blood from the great saphenous vein, and creating then inside the abdominal cavity the external iliac vein, which combines with the internal iliac vein. In this video we can only see the left side, the same mirror images on the right side, creating here the left common iliac vein and here the right common iliac vein, who combine towards the inferior vena cava. The neck blood coming into the inferior vena cava is on the right side, the gonadal vein, and then on the right side we have the renal vein entering the inferior vena cava. On the left side you see it's different. The renal vein flows up not into the inferior vena cava but into the left renal vein, which drains the left kidney, and with that blood flow coming back to the inferior vena cava. The inferior vena cava then is more visible in the model of the liver in this case, and then flowing up towards the heart. What also in the upper torso, or the upper body area, we have the internal jugular draining with the right subclavian vein into the brachiocephalic vein, and on the left side mirror image we have the left internal jugular and the left subclavian vein combining to the left brachiocephalic vein, who then enters. Both of these brachiocephalic veins combine and drain towards the superior vena cava, which again is very nicely visible here. And you can see also from the heart we have the inferior vena cava entering here in this model. Sorry, a little bit hard to get in. Just here quick on the side, you can also see from the pulmonary trunk how it splits towards the pulmonary arteries entering the lungs.